Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we will be talking about dental care for dogs, and joining us for all of our questions is Dr. Chris Roth. Thank you so much for being here.
You bet. Thanks for having me.
So, Dr. Roth, how do I take care of my dog's teeth at home? For example, what toothbrush should I use? My toothbrush, a human toothbrush, a dog toothbrush? What should I use?
So I don't think it really matters what toothbrush you use. I think it's more of the mechanical action. I definitely would say soft bristles. Your dog will like that more. And what I used to tell my clients was, when you're done with your old toothbrush, put it in the drawer and use it on your dog and get yourself a new one. So, like I say, it's more the mechanical action and actually getting in there and getting the gums and the teeth clean.
And do dogs really need to have their teeth professionally cleaned? If so, how do I know? When do I know to take them in for that?
So absolutely, it will kind of depend on your dog's mouth and your dog's teeth. Current recommendations are every 6 to 12 months. We brush our teeth 2 or 3 times a day, and we still get tartar and plaque on our teeth, and we go in every 6 months.
So do you have any specific recommendations on what I should clean my dog's teeth with?
Nothing's better than brushing. Certainly use a good quality pet toothpaste. But there are other things you can do. Some dogs just will not tolerate a brush in their mouth.
Are there any types of foods that can help clean my dog's teeth?
Absolutely. There are numerous specific diets out there that help to clean dogs' teeth, along with the treats that have an enzymatic cleaner. The dog food works differently. It's more mechanical. Regular dry kibble that a dog will bite into, as soon as the teeth start to bite into it, it shatters into pieces. So it doesn't do a really good job of cleaning the teeth. These new diets, they're bigger kibble, and the teeth actually sink into it. So as the tooth goes in, the food kind of scrapes the plaque and tartar off of the tooth. So it's more that mechanical action that's kind of helping keep the plaque and tartar off the teeth and kind of massaging the gums and trying to keep them healthy.
I'm seeing a lot of dental chews and treats in the store as well. Do those work as well for our dogs?
Absolutely. Along with the mechanical action of the treats. Treats nowadays are impregnated with enzymes and such that help to kill the bacteria that cause the bad breath and the plaque on the teeth.
So with all these different ways of cleaning your dog's teeth, you still recommend it needs to happen every day to stay on top of it?
Absolutely. And if you can brush your dog's teeth twice a day, better yet.
And what would some consequences be of not brushing my dog's teeth?
So unfortunately, that's a big part of veterinary practice is dental work. So one of the biggest problems that you'll see is periodontal disease or infection around the teeth and the gums. And that leads to abscesses in the roots of the teeth, loosening of the teeth, and a lot of those teeth that get bad enough need to have the teeth extracted. But it's not only the mouth that we have to worry about. When that bacteria gets along the gums and along the teeth, then it is in direct contact with the bloodstream. So you'll get bacterial infections in the blood. And so that can go to the heart, and it can go to the liver, can go to the kidneys. The liver and the kidneys are filters of the body. So if there's bacteria floating around in there, then it's going to get filtered out by the liver and kidneys and cause issues there as well.
What would some signs be of my dog having an issue with a tooth or a mouth issue?
So I think the biggest thing that probably people are going to notice is bad smell, halitosis. They're going to have a very strong um, odor coming from their mouth. They might not eat as well. They may chew on one side of their mouth, kind of tilt their head over to the side and just chew on one side. Um, and that might be a sign that the other side has a tooth that's bothering them. Sometimes when they're chewing on a treat or even their food or a chew toy or something, you might see some blood on there. Certainly that can be a sign as well.
Is excessive drooling a sign of a mouth infection?
Um, certainly it could be if the tooth is really sore. Absolutely. I mean, they might drool a little bit. Maybe more of a sign of some stomatitis or an infection maybe somewhere else in the mouth, but certainly could be a bad tooth.
And now, what is canine stomatitis and how do you treat it?
Stomatitis is basically it's just an infection in the oral cavity in the mouth. It's kind of like a canker sore in people. So you would treat it with you could flush out the mouth with an antiseptic that you got from your veterinarian. In a severe case, you might have to use antibiotics and actually some pain medications because we all know canker sores and stomatitis is painful.
And a lot of people have concerns about putting their animals under anesthesia for a teeth cleaning. What would you say to those pet owners?
Well, anesthesia is very safe nowadays. What I used to tell my clients is the risk of the infection and the disease that the periodontal disease is causing poses much more of a risk to your pet than anesthesia. The periodontal disease, the infection is there 24/7, all day, week, month, year. The anesthesia is only there for 2 hours.
Well, thank you, Dr. Chris Roth. This has been so informative on our dog's dental care. So everybody go out and brush your dog's teeth. And thank you so much for all this information. Thanks for joining us.
Yeah, thanks for having me.
More episodes of Care Experts can be found at carecredit.com/careexperts. Remember, your CareCredit credit card is accepted at hundreds of thousands of provider locations nationwide. To get more information on how the Pets Best pet insurance can cover up to 90% of your pet's unexpected veterinary expenses, visit petsbest.com. Or for more information on the CareCredit credit card, go to carecredit.com.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. All information, opinions, and recommendations discussed in this episode are for your information only. We believe the information sources are generally reliable, but because of possible human or mechanical error by the sources, Synchrony or its affiliates, including CareCredit, does not provide warranty to the accuracy, quality, or completeness of the information or any results obtained from it. Any statement or opinions in this episode are the doctor's alone, and included data was current to the time of creating this episode. Please consult your own advisors before using any of this information. Pet insurance coverage offered and administered by Pets Best Insurance Services, LLC, is underwritten by American Pet Insurance Company, a New York insurance company headquartered at 6100 4th Avenue South, Suite 200, Seattle, Washington, 98108. Or Independence American Insurance Company, a Delaware insurance company located at 11333 North Scottsdale Road, Suite 160, Scottsdale, Arizona, 85254. Pets Best Insurance Services, LLC, California Agency Number 0F37530, is a licensed insurance agency located at 10840 Ballantine Commons Parkway, Charlotte, North Carolina 28277. Each insurer has sole financial responsibility for its own products. Please refer to your declarations page to determine the underwriter for your policy. Terms and conditions apply. See your policy for details.